This is a CBS 4 News special report.
Florida Governor Ron DeSantis is holding a news conference right now at Tampa General Hospital, updating us on the latest on COVID-19. Let's listen in.
But Hillsborough County, a state that has over 1 million people, right now, total number of people hospitalized for COVID-19 in Hillsborough County as of last night was 35. That's about a half hour in Brooklyn right now in terms of people going in for hospitalizations. The peak hospitalization in Hillsborough County was 70 on April 8th. And so the current hospitalizations per 100,000 residents in Hillsborough County is 2.5. That is one of the lowest rates you are going to find anywhere. And I think that that's a testament to the people here who've done a great job, and to folks like we see at Tampa General and some of our other health systems. So my hat's off to you. I think you guys have done a tremendous job and have really shown the way. And you look at some of the things where, you know, we were told just 6 weeks ago that all the hospitals would be overrun, that people wouldn't be able to get care, and there was a lot of stories being put out about kind of almost the end of the world. People were really, understandably, when you hear that, very, very scared. You remember there was all the discussion about people aren't going to have a ventilator, they're not going to be able to get the care they need. Well, in the state of Florida right now, we have 6,408 ventilators that are just simply sitting idle. In fact, the total number of patients we have on ventilators for COVID-19 statewide is about 400 as of last night. So the fact of the matter is people are getting great care by people like you see at Tampa General, and a lot of those doomsday scenarios have just simply not come to pass. And interesting, we have a state where you have almost 40% of the cases are in one county in southern Florida, Miami-Dade. And they've had, I think they're probably up to close to 12,000 documented infections. They, along with Palm Beach and Broward, they're basically 60% of all the cases. They're more than 60% of the hospitalizations, and I think same with fatalities. But even Miami-Dade, which is kind of the place that's seen the most in Florida, you talk about hospital resources, you talk about hospitals having a capacity and not being overrun. Miami-Dade, the available adult ICU beds as of last night, 45% of their ICU beds are available. And this is the part of the state that has seen the most cases. And so I think that that's a testament to the fact that you go back 6 weeks, the predictions were that you'd have, and there were predictions for hundreds of thousands of hospitalizations in the state of Florida. Actually, one said 465,000 hospitalizations. We have a statewide, we have a little bit under 2,200 currently right now, but you've seen the hospital system hold up. There's been capacity. That has never been an issue at any time during this. And so I just think it's important for people to know that, and I think it's important for, particularly if you're in Hillsborough County, to look at the numbers and say, man, who would have predicted 6 weeks ago that they would have been able to weather it this well? So my hat's off to folks. We talked a lot, and I'm going to let Dr. Lockwood and John and some of the others go into detail, but we're all very focused on testing. We've, of course, done a lot on testing in the state of Florida. The state has supplied the site that Tampa General runs by Raymond James Stadium with swabs and a bunch of supplies, PPE, throughout the last 6 weeks. The good thing is that they're able to see a lot of people, patients go through there. They don't always get the full demand, and maybe that means that there's not as many people that are symptomatic. Most of the people that are testing in the state of Florida overwhelmingly are testing negative, which is a great thing. There's some jurisdictions in the country where you'll have 30, 40, even close to 50% of all test takers will come back positive. In Florida, the last, I think, 4 days, we've had 6%, 5%, 4.5%, and 6% in terms of all the test results, the percentage of new cases positive versus negative. And so that's been a downward trend. We were never that high compared to some other parts of the country, but we've gone from kind of that 10% now down into a 5%-ish, 6% range, which is a good sign. I think Hillsborough County, certainly here, most of the tests they're doing overwhelmingly are coming back negative. So Florida has done, there have been 357,000 tests reported to the Florida Department of Health thus far since this endeavor. As I mentioned, South Florida is where the bulk of the cases are. There's been one test result for every 42 people who live in those 3 counties. And we're, as I said, happy about the positivity rate. The drive-through sites that we have, we're going to continue to do. I was talking with Dr. Lockwood, and initially when this started in March, the CDC had very narrow criteria about who could be tested. And just it's important for people to know those days are gone. That's the past. You have access to testing. If you're somebody that wants to get tested, you have the ability to do it. Clearly, if you have any of the coronavirus symptoms, we would strongly recommend that you come to one of those sites or some other options and get tested. But even if you're somebody that may not have symptoms, maybe someone you know tested positive that you were with previously, you may want to come in. And so we are welcoming people to want to do that. We think it's important not only for individuals' health to know whether they're positive or not, but also for professionals like we have up here to understand the prevalence of this throughout the community. We're also doing things, and we're doing it in Hillsborough as well as some other counties around the state. The drive-through sites are good. The drive-through sites are convenient for a lot of people. But the fact of the matter is not every person in Florida owns a vehicle. Not every person had access to go to those drive-through sites. So we thought it was important, after we worked with the University of Florida, to do a walkthrough type concept. Started at a public housing project in Jacksonville and are now going to different areas throughout Florida which may be underserved. We're getting into communities, offering testing on a walk-up basis. Just in the last week and a half, when these have started to be done, they've already done 5,000 tests, and we're going to continue to do many more. I had a chance to speak with Dr. Birx at the White House this morning about some of the things Florida's doing. She loves our website, loves the Department of Health, but she complimented Florida on, if you look, the Department of Health publishes the data, demographics, and you get to see different things. You don't see massive disparities on racial or ethnic grounds in Florida. It tracks pretty closely. And you may go up here or there depending on the situation, but some of these areas it's just overwhelmingly out of whack. But I think having some of these types of concepts where you're getting into communities, particularly communities that may be underserved, will help us prevent seeing it go in that direction like we've seen in some other states. John and I early on, and I think John will talk about this, but we knew how this disease affected the elderly really from the start, and it was really important to protect the vulnerable here in Florida. So we've done that with what we've done with nursing homes, a number of things between limiting visitors, screening all the staff, requiring PPE,